Communication access in healthcare is also an area that is not well understood. There are many mistakes and there's much exposure. What do we mean by communication access? It's providing content and methods that are understandable and usable by people with reduced or no ability to see, speak, hear, or limitations in learning or understanding. You all know what the content is. I don't think I really need to review all the content that people get bombarded with in healthcare that they need to be able to use. So what about this QSA? Use the assisted listening device. In case you don't know what that is, that's some advice used by people who are hard of hearing, so they can actually hear the discussion between the provider. Kaiser is instituted the install of these throughout the pharmacy system in California. And guess what? The users, when it's presented in a non-threatening way, love it so much they want to take it home. Take it home. So, another QSA. When calling this patient, use the TTY, or use the relay service, or use speech-to-speech relay. Or this alert, needs sign language interpreter, scheduled 2 weeks before the routine appointment. What a concept, right? Or this, needs double appointment time, uses a communication device, or needs help with transferring or positioning. Communication device, and it's not this kind of transferring. We've tried forklifts, and they don't work. But people do need assistance getting on and off tables, and it's an issue. And it's also an issue for screening. You know, this woman is saying, I can get my wheelchair through that door, but I don't know how I'm going to get my body into that machine. I think another opportunity on the provider side is access instantly to evidence-based practices for populations that have low prevalence in a primary care provider's practice. And often there is an evidence-based practice, but at least there's some good practice or consensus practice. What a concept if that could just pop up. And of course, care coordination, which I think you'll all cover later. QSA, needs care instructions in audio, on tape or on CDs, in large print, electric format or braille. Information that people can use and understand. Now, on the consumer side, and as you can tell, I'm talking to you from both a consulting provider and consumer side, but I like that this is the fun side for me. In the ideal world, would allow me to trigger those QSAs for the provider before I ever got there. Now, in the real world here, I'm what you call an early adopter, real early adopter. And I've been using a PHR for years because basically a lot of what I do is help people navigate the healthcare system and teach them how to have the skills to be their own healthcare co-manager and to be part of the process instead of what often happens, which is being processed. So these skills include directing the show and breaking down a lot of those silos where your providers never talk to each other, but again, it's care coordination. So I've done this because I got tired of trying to remember all this stuff over and over again and accurately try to answer the question. And I really thought it was a waste of time to keep doing it over and over again. So let me tell you about what happens in the real world. Okay, I go into the provider's office, I'm at the front desk, and they say, please fill out these forms. And I hand them the appropriate section of my healthcare record. And I say, everything's right here. And they say, you have to use our forms. And I say, if you want to be able to read them, you put it on your forms. And then I get the look. And then I get into the primary care provider, a new guy, because the old one left California, and he says to me, well, you sure make my life easier. This allows us to really get down to more in-depth discussion. We don't have to waste any time. Or I go see a specialist, and she says, where did you get this? And I said, I developed it. And she says, can I use it with my other patients? And I say, sure, just give me credit. So, usability. Making these cool tools usable in whatever you do, I need to remind you to stop and remember. The second prong of access involves people who have alternative ways of accessing internet content, which is not the usual mouse clicking or screen browsing. It's voice input, number one. It's alternatives to mice, number two. It's screen readers, number three. And it's mouse sticks and pointers. What does this mean for you? It means very strict attention to the 508 standards and the World Wide Web Consortium standards on accessibility. Very important. So, another word about reality here. Given this very well documented upfront cost that you're all talking about it and the resources to do what you want to do, I say we have to be real. Since I worked for 8 years in Washington promulgating electronic and physical access regulations on the Access Board, I have a very clear understanding of what it takes to make sausage, or regulations that is. And I also have a very good understanding of public policy time. And basically for me it's like geologic time. Forever. So as you're doing this, and this may or may not happen in our lifetime, I say make pieces of it usable now. And I think, portability is key, and it's not being confined to just having it online. The vast majority of us are not confined to anything. We're moving, we're traveling, we're working, and it starts with S and ends with T, happens. And our Katrina is still waiting to happen here, and will happen. So the point is that we need to be able to access these things in hard copy as well as just online. It won't work just online. And also, since some of us have been doing this for a long time, we have some reluctance to use your templates. We want to throw it up there and have it usable and not have to spend hours doing it your way when we've already done it our way. So portability is key. I want to be able to save it on my computer. I want to be able to print it out and carrying it into the provider, because guess what? No matter how much we dream, the real providers out there, Unity Clinic providers, they don't have those computers in those exam rooms. And if you don't hand them a hard copy, it's like it's not there for right now.